So with this class, I'm doing the first part and then she's doing the second part, so that's why I'm doing some guys. Okay, so the next part is baby blues. We kind of talked about this a little bit already today. The onset typically occurs about the 3rd day, peaks around the 5th, and subsides by the 10th day. This is 80% of moms. I've actually heard a higher percentage rate than that. Signs and symptoms: depression, restlessness, crying spells. That's a big one. Sleeplessness, anger towards other family members, including the baby. Why can't you just sleep for an hour? Anxiety and moodiness can be related to the lack of sleep or the hormonal changes. Characterized by mild depression, tearful, anxiety, confusion, lack of energy, changes in appetite, or temporary mood changes. Others can help by doing what needs to be done so the new mom can rest. They can help with chores, provide good healthy meals, praise for parenting. Can also be reduced by breastfeeding, which releases that feel-good hormone called prolactin. Postpartum depression. Onset can occur between 2 weeks and 6 months after the birth. Here at Healthy Start, we do the test at 4 weeks after you deliver, and then depending on what your score is, we will either refer you back to your doctor or counselor or keep watching you. Prevalent in 10 to 15% of new moms, and it occurs in 20% of moms who had baby blues. Signs and symptoms: an intense and pervasive sadness with severe and liable mood swings, meaning you're really depressed and then you're really angry. Then you're really depressed. It's like a pendulum. More serious and persistent than postpartum blues: exaggerated and prolonged irritability, increased intensity and duration of depressed feelings. More intense feelings of sadness, anger, despair, panic attacks, feeling powerless, helpless, easily angered, socially withdrawn, memory and concentration may be impaired. Symptoms interfere with daily functioning due to the inability to cope. Inappropriate responses to infant and family, perception the infant is demanding and burdensome. Lack of emotional support at home is thought to be a predisposer, but they really don't understand this. Basically, if you are so tired and so down that you do not feel like taking care of your baby and yourself, welcome to postpartum depression. Okay? We do not know who it's going to happen to, and especially with our new moms, we don't know. Okay? If you've had it before, you do have a higher chance of getting it again. On Tadra, it sounds like you've been good each time, so hopefully that continues for you, and it should. Medical attention should be sought since the symptoms rarely disappear without help. Medication sometimes is needed, but most of the time mom needs a good counselor. Okay. Others can help by encouraging the mom to seek professional help, ensuring that she's eating correctly, getting enough rest, praising everything you can, especially her parenting skills, encouraging breastfeeding, which reduces this. There is postpartum psychosis. Postpartum psychosis is when the mom feels that she, the baby, or both are better off in heaven. Okay.
Whoa.
This is Andrea Yates that drowned all 5 of her kids. This is Susan Smith, put her kids in a car and rolled them into a lake. This is Ebony Wilkinson, who drove her car into Daytona Beach with all her kids in it. Okay?
I remember that.
Yes. Onset may begin within days after the birth. Most often occurs 2 to 3 weeks, but almost always within 8 weeks after the birth this happens. It's 0.1 to 0.2% of new moms. Thankfully, this is really rare, but it is a break with reality, characterized by periods of thought disorder, including thoughts of harming herself, the baby, hallucinations, paranoia, delusional thoughts. This is an emergency. We must get the mom immediate medical and psychiatric treatment. Mom is probably going to end up in the hospital for a while, sometimes for months. How can you help? Dads need to know or caregivers need to know the risk factors for this. The mother should never be left alone with the baby, and providing care and assistance for the baby with other caregivers. This is not a joke. This really does happen, unfortunately. Sorry. Returning to pre-pregnant shape. Talk to your doctor. What can you do? How fast can you start doing exercises? How fast can you swim? All questions for your doctor. Kegels. Kegel. Start slowly. Walk halfway down the block and back. See how you do. Try that for a couple of days, then try a little bit longer. Take precautions. You definitely don't want to go outside and try to run a marathon a week after you've had a baby. Not the way to do it. And determine your caloric needs. So basically, if you're breastfeeding, you need about 500 additional calories a day, which is about what you need when you're pregnant. So if you're breastfeeding, you probably want to stay at the same amount that you're eating now. So now we're going to talk about family planning, because unless you're getting your tubes tied, your chance of having another baby after delivering is very high. Okay. So consequences of unintended pregnancy have been well documented by the Institutes of Medicine and other. The fact is, a woman with an unintended pregnancy is less likely to seek early prenatal care and is more likely to engage in behaviors, smoking, alcohol use, drugs that can hurt the baby. Children who are unwanted are more likely to experience abuse, neglect, and other relationship problems. We told you before, if you cannot attach and bond to the baby correctly, the baby has issues. Some of the consequences of poor baby spacing: exact serious health consequences and social costs. Low birth weight, high rates of infant mortality, inadequate family support. Researchers believe that babies born too close together are less healthy because the mother's body has not fully recovered from the previous pregnancy. And mothers with unplanned pregnancies are more likely to have poor nutrition, including low intake of foods containing folic acid, the vitamin that helps prevent birth defects. So we want to talk about your family planning options. We do have them here, at least most of them. Unless I throw them on the floor and then did it break? Yep, did it break. Okay.
Well, the lid popped off.
Yeah, it goes back together, so I'm not freaking out. So we're going to kind of go through them. Of course, all of these, or at least most of these, have to do with your personal situation and your personal medical history. So you always have to talk to your doctor about which one that you're going to go through. So we're going to go in order off of there. So the first one listed is the birth control pill. There are two types of birth control pill. One is the, I guess we'll call it the big pill. It's a combination of estrogen and progesterone. If you're breastfeeding, you cannot take the big pill. You have to take what they call a mini pill, which is progestin only. Okay. We all know that the biggest thing with birth control pills is remembering to take them every day at the same time. Okay. So if you're going to have that problem, and I promise you every mom with a new baby is going to have that problem, this may not be the right choice for you. I'm going to go ahead and pass these around so you guys can see them. However, you can get that birth control pill in a form that you don't have to think about every day. So this little green rod down here at the bottom is an Nexplanon. And this is the exact same hormone as the mini pill, or progestin only. It's actually inside. And they take this plastic rod and using a needle, they put it inside your upper arm. And I'm going to pass this around. You guys can kind of feel what this feels like inside. These generally will last for up to 3 years. Okay, baby spacing is 2 to 3 years, so this lasts for 3. And then they do have to take it out, little nick in the skin, pull it out. Okay, so this can be a good option for some moms.
That's what I'm doing.
I think I've brought that one to you before, haven't I? Did I ever have yours? Maybe not.
I don't know.
Okay, so the next one is Depo. Depo is the shot that you get every 3 months to prevent pregnancy. Depo has some success, however, there's a lot of side effects with Depo. So that's definitely one that you want to talk to your doctor about. The next one on the list is a tubal ligation. This is, of course, when they go into the uterus and they cut the fallopian tubes. Can usually cut tight and burned. And that way it prevents the egg from going from the ovary to the uterus so that the baby cannot grow. This is a permanent procedure, although sometimes they are able to reverse, but that tends to cause a lot of issues. So this is only for moms who are sure, done, cut, tie, and burn, do not want any more. Okay? Having a tubal ligation is a 6-week recovery because it is a major abdominal surgery. However, the next one on the list is a vasectomy. And in a vasectomy, they go in through the scrotum, one little cut, take out the vas deferens, which are the male version of the ovary, or the male version of the fallopian tubes. Sew the dad up, and he can go back to work usually by the next day or 2 days. So kind of the same thing, just a lot easier for men. Maybe not ego-wise, but it is definitely easier.
The least you could do.
Yes. No, I
I'll
didn't
give
get
you a
it.
bag of peas. Frozen peas.
We missed one.
Kids.
Hang on, we have technical difficulties. We left one in the box. I'm fired. Just fired, I'm fired. We have all the books in here too, so sometimes it's hard to grab them all. Where is it?
I'm not sure. I don't remember what conference
Like, is it?
The dental dam. Aww.
Did we lose it? Oh, there it is.
There it is, okay. So I'm gonna take this one out just because most people have not seen this one. So this is a dental dam. This is for oral sex. Basically, it's a condom for oral sex. It is if I can get it out, it's basically a flat piece of latex that would be placed over the female's labia. It is banana flavored. Yeah, so I think everybody gets the idea on this one. There's too much giggling going on, so I'm just going to pass it.
And nobody lick it, please.
Yes.
There have been lots of
Do not touch that one. Don't do it. Don't do it. Okay. So the next one is the male condom. Everybody has seen a male condom, I'm sure. We've been... I can guess it's Virginia.
I didn't see
I
anything. That's weird. It was me that time.
Okay. You two stop or go.
And it wasn't even that's what she said.
What is that? It's about birth control that makes grown-ups feel yeah. So I'm sure everybody has seen how to use a condom, maybe even used a condom, but we do have a male member in the other room, so if anybody does need assistance with learning how to use these, we definitely will do that. Outside of the shot of the camera and everybody else. Just saying.
For the comfort of your privacy.
Yes. Because I'm not doing that on camera. No.
Not with you here, anyway.
I'll totally do it on camera.
I should tell
you.
you.
Really want me to?
Okay. So we were doing a training with this, and my boss is like, "Go ahead and do it for everybody." So I'm sitting at our other office. The couch was right inside the door like this, and I'm rolling it down, and there's a knock at the door.
This one jumps up because I seen who it was. It was a coworker.
Yeah.
And goes to open the door and she starts freaking out. Wait. And she shoves him down in the pillow. Our other coworker, who's very shy, very won't even say the word penis, jumps from her couch all the way over to where I was sitting. Like she didn't even want to be sitting right there. So she
And then of course when the coworker comes in, we're all dying on the floor, and she's like, "I'm not that funny."
She's like, I just had to use your restroom.
It was very interesting. But yes, that was the last time I had the male member out, and yeah. If I get it out this time, it will be in the back room with the door closed. Okay, has everybody seen a female condom? Okay.
I was like, nope.
Heard about
Yes.
it, seen it on the internet.
Okay, so this is a female condom. The opening is a lot wider.
I'll grow up. Okay. What's going on here?
Tell them.
Oh, you finish it just explaining and then you can say why you're laughing.
So the outside is wider than the male member would be, so that it helps prevent the female from getting genital herpes or spreading genital herpes. You do have to take it, squeeze the inner ring. There's a plastic ring here. Put it in. You want to make sure that it does not twist. And then intercourse would happen through the edge here. Through the end where my fingers are. Okay, it can crinkle a little bit, but that's usually the worst part of it. Now I'm willing to send this around outside of the bag, but this is a real one, so it's lubricated, so it's up to everybody here. You guys want to see it or not? Yes.
And it is not as easy as she makes it sound.
No, it's not. But you know what I find? Because I've used those before. To me, it's better protection than a male condom, you know? And it looks crazy right there, but when it's on, it actually, goes like behind your lips, so it kind of does stay in place. But you don't have to get none of their skin on you
Popping
at
out of
all.
my fingers.
And that's why we were giggling, because she told us that right before class.
And I'm trying to ignore it, and it just won't stop
I
laughing.
tried it. I was like, I can't go to somebody and be like, you should try this.
It's gonna be a stupid question. Do they have different sizes of those as well?
Nothing's a stupid
Exactly, no stupid questions here.
They don't have different sizes because it's just like the NuvaRing, which she's gonna show you in a few minutes. But the ring actually goes up around
So
the
is it
cervix.
stretchy though?
Why didn't you touch it?
Gross.
I don't think it's been
I'm
used.
sure you've touched worse. I'm just saying. Okay.
The ring
It
is
is
harder
Yeah.
at the bottom than it is at the top.
Yes. So this is a form of birth control our moms tended to use a lot. This is a diaphragm. And basically this would be fitted to the woman's cervix, how big it is. These do come bigger and smaller. And the mom would cover this in usually a spermicide, fold it in half, slip it in the vagina, and let it go over the vagina. It would sit there for up to a few hours before you had sex, and then you'd leave it into the next morning. Then you got to take it out, wash it, put it in this nifty case, and carry it around in your purse. Yes.
Okay.
Yes.
Let's take that Diva
That
cup.
seems like a lot of work.
I'm telling you.
Right?
Why did you have to go and bring
I
that
think
thing
it
up?
just continues.
Okay.
Because
There is a second one called a cervical cap that is about the same thing. It's just a lot smaller, and I do not have one of those. So I'm going to send around the diaphragm. You'll notice that the diaphragm actually does have a hole in it, so don't take it and try to use it. Just saying.
Not only for the fact that it also has to be, you have to get it fitted for yourself.
Yeah, well, that goes
Well, I think damage is done, so.
Well, we're talking about, so there's not a second one too quick. Too quick. Okay. So, the next one is an IUD. There are a few different IUDs. One is the Mirena, which they've had a lot of recalls on, so Medicaid doesn't usually pay for that one anyway. This one is the Carpati. It's also called Paragard. It is actually, if you look at it, got a spring of copper around it in 3 different places. The rest of it, or the blue part, is plastic. They insert this, it's in a little tube, they put it in and let it go. We had another one and we broke it, so I'm trying not to take this one out anymore, because I think I did, and I actually kind of broke this one a little bit putting it in. They would put it in, and then they would trim these strings. You would not have strings hanging out of you, I promise. What this does, the copper actually helps you not conceive, and then the IUD itself prevents the actual implantation of pregnancy.
I had this
Did you?
for 2 years. That's how I end up in this predicament right now, because of that crap. That thing killed me for 2 years. Like my period, oh my God. I was a smoker then. So I had to get the one with no
Hormones.
particular hormone.
Right. So you have this one.
Because you know, smoking and birth control can cause heart disease. Okay, so that thing had my period on for 10 days every month for 2 years. I was like, you know what?
Well, that is a side effect that Antandra had with it. That
Yeah.
is not typical.
It's not for everybody.
Right. Not typical.
Okay.
Okay.
Send it to Mirena, right?
Well, my sister-in-law had one, and my friend Lisa had one,
Mm.
and both of them had to go to the hospital because it moved. And
Oh, God.
yeah, both of them almost had to have surgery. Luckily not, but
Right. So
that's what scares
everything
me
here,
about 'em. I don't want it to
everything
move.
here can have a side effect. Everything here can cause issues. Everything here has a reason that we want you to talk to your doctor. That's why the first thing I said was, I don't know your medical history. Talk to your provider. Okay. The contraceptive sponge, we don't have any of those either. We need to buy them. They're just at the store. But basically, it is a little sponge. You wet it and put it against the cervix. Okay. We also have the vaginal ring. This is not a real one, so we can pass it around. And then we have the patch. Both of these contain that hormonal pregnancy, or hormonal birth control, like the birth control pill. This one goes inside the cervix, around the cervix. Since it's there for a week, then you replace it. This one is actually a patch that goes on the skin that you wear for a week, take it off, put the next one on. Each of these you would leave off for 1 week to have your period.
Oh,
Pass
wow.
these around.
So this you put in yourself once
Yep.
a week?
Yep.
Oh, really?
Yes, ma'am. Works kind of the same as the diaphragm. It's just the diaphragm you leave in, put in and out, whereas that you're going to leave in for a week.
Mm. How do you get it out? Is
You-
it something
you
that
just-
you use? Oh, you just.
Yeah. Yeah.
Oh.
So it's something that you would have to be taught to use, but it is doable. Of course, you're
No,
putting
I
a
don't.
tube line
Of
in,
course,
so
yes, I am.
okay.
Just
So
here,
Me and
do
these
that.
things don't get along. We don't get along.
yeah.
I'm like that guy with the phone, you know, that commercial where he's like, the phone slips out of his hand and he's like, the whole way home and then it flips and that's how me and these things are. We'll put it at the floor.
I cannot wait till it's your turn. I'm probably gonna go in my office and have a cry.
Honest.
User accounts are nice, thank you.
This is Plan B. So this is the morning after pill. This is not really birth control. This is I goofed up.
This is oh shit.
That's another good way to say it. Plan B is regulated by the state. You can only get 3 or 4 a year. I'm not sure which one. It makes moms very, very sick. It is not a form of birth control. Please do not ever need this. We're asking.
Very expensive.
Yes, very expensive as well. We really want you to choose a better plan before we go with this. But I would be remiss if I did not talk about these. Okay. This is a natural family planning choice. These are called cycle beads. So only if your period is very, very regular and you're in a long-term committed relationship where we're not worried about STDs. Every day from the start of your period, you're going to move the ring 1 day. Then when we get into the white beads, which are actually glow-in-the-dark beads, we'll know that if we're going to have sex in this time period that we need to have a backup form of birth control. Okay. These work about 60% of the time. So if you're using this plan, this method, please know that there is a chance that you're going to get pregnant. That's why I saved this one for last. We want you to choose an option that's good for you, that's more long-term, that you don't really have to think about after you have a baby, that is going to work for you.
And that also goes with the apps that you might get. Like,
Yeah.
if you have a period tracker app, those work just like the beads, except for they're doing it every day for you instead of the. But it does the same thing.
I'd be like, oh, where's that supposed to be again? Because I would forget
How
to
many
move it.
days?
Right.
Yeah.
But even on those, you have to, even on the apps, you have to remember to go in and when your period started and when your period ended, so
Right.
that it can log it the correct way.
And remember, even with the cycle beads, with the apps alike, it's all an educated guess. You can still get pregnant. So that's a lot of information. Do you guys have any questions or any concerns? Do you want to see any of these types again?
Do you want her to demonstrate the condom for you?
No, thank you.
Come on, she really wants to. She's dying to.
Now, can any of these be felt during intercourse?
They should not be. With the IUD, if the strings are too long, yes, that's something the doctor can go in and trim them. Anything like the cervix or the vaginal ring should not be felt. Obviously, the Nexplanon is in the arm. Obviously, you're going to feel condoms to a certain degree.
Right.
But
I was
no.
thinking more on the
Like the
rings and
diaphragm,
stuff like
right.
that. Yeah.
Yeah, it's going to be lubricated the same as the rest of the vaginal area, so really it should not be felt. Of course, if it moves or something along those lines, you want to stop and fix it, but you might feel it then, but usually no.
Would she be able to feel it?
There might be some pressure, maybe, but I don't think it would be anything uncomfortable or anything that would cause women not to use it. The diaphragm was extremely popular in the late 70s, early 80s, kind of everybody had one. And it's one of those deals when things don't feel good or they're kind of annoying and icky, we don't tend to use them. Although now, of course, we're saying we have to take this out and wash it the next morning. That's disgusting. Put it in my purse, ick. But that's what they did. So,
Back then, that was high tech.
Right.
well, that's true. That's true. Any questions? No? All right, so here you go.
All right, so parenting tasks in the first 6 weeks. So this is where we're gonna go over a lot of wonderful stuff for you and your new baby. So So find some way to get rest. We talked about that. Getting to know your baby, bonding, spending as much time as possible with the baby, balancing visitors and your needs. This is when I was telling you, if they come, they need to do something for you. Otherwise, they have no business being at your house. Hearing advice and doing what you feel is right. So you can actually even tell people, like, I don't want unsolicited advice. If I want your advice, I'll come to you and ask you. Trust that if I want your opinion, I'll ask. You want to spend time alone with your partner as well. So you want to spend time with Chris and Brianna, your significant other.
Sorry, sweetie.
Exactly. And then accepting help. Like I said, don't be afraid to be like, you're coming to my house tomorrow. Can you bring a casserole? Can you stop and pick up a pizza, which isn't necessarily healthy, but hey, you know, whatever they can do. Maybe they don't cook and they need to pick up something.
Just tell them to put green peppers on it.
Exactly. Put some veggies on it.
Vegetables, perfect.
Exactly. Put some veggies on it.
Whole pyramid on there.
Exactly. Learning your baby's cries, so you're gonna know that pretty quickly. You're gonna notice when your baby cries this way and you feed the baby's good, but maybe other times it's because the baby needs to be changed. You'll learn that. Keeping things in perspective.